Good morning, dear Chairman and colleagues. Firstly, I want to thank the organizing committee for this opportunity to give a talk here today. And I'm going to talk about the third space endoscopy as the new era of endoscopic surgery. And this is actually sounds like a fancy title, but it conceals a wide range of really great technologies I'm going to talk about the next 10 minutes. But first thing I want you to do is to look at this picture. What do we see here? This is the so-called the third space. And in my presentation, I will cover two things. First, what do we actually mean by the third space? And what can we do in the third space? And starting with the first one, needed to be mentioned that the endoscopic surgery until recently meant a work in the two main anatomical spaces. First, the intraperitoneal space, which is the space inside the abdominal cavity. And the second, endoluminal space, which is the space inside the hollow organ lumen. And the concept or ideology of some kind of the third space located in between these two gave a start to the new era of endoscopic surgery and opened the door to a wide range of procedures which do have one thing in common, a work in the basically new artificial space. And the concept of the third space endoscopy or submucosal endoscopic surgery is based on the principle of approach to the underneath structure of the GI wall by means of tunneling dissection, which literally means the creation of the tunnel with no compromising of mucosa, except the entry point to the tunnel. From classic hydrodissection to the new technologies of tunnel creation using balloons. And all procedures related to the third endoscopy, like listed on the slide, ESD, POEM, STAIR, and beyond, do have one thing in common. It's a work in the submucosal space. And needed to say that despite the fact that submucosal endoscopic surgery is a relatively new and modern direction, we can watch the evolution already. So, the endoscopic submucosal surgery was studied traditionally with ESD technique, endoscopic submucosal dissection, with the main benefit of getting one-piece specimen of mucosa and partially submucosa in order not only to be able to remove the lesion completely, but also, which is more important, to get a good assessment of vertical invasion on pathomorphology. And here you can see on the video the steps of procedure. And then, firstly done in 2008, POEM procedure was based on the existing principles of ESD technique on the one hand, and on existing principles of treating of achalasia as cardiomyotomy on the other hand. And here you can see the steps of the procedure, which I'm sure you know very well, which include the injection, the submucosal injection, the creation of the entry point to the tunnel, the cutting of mucosa, and the tunnel creation, and then the steps of dissection of the muscle fibers in the submucosal space. But the POEM procedure, which was done in 2008, and the last year it was the 10th anniversary of this procedure with a proven efficacy and little complications. It's shown that today we have a lot of new techniques which actually are the derivatives of POEM procedure. And among them is pyloromyotomy performed for pylospasm or gastroparesis or other gastric motility disorders, also known as G-POEM or gastric POEM, with the same principles of surgery. Or it's led to the development of Z-POEM, or the POEM procedure for Sanker diverticulum, with the same principles of surgery, the dissection of the muscle fibers in the submucosal space. And also, this led to the PREM procedure, which is perectal endoscopic myotomy performed for the Hirschsprung disease. And the surgery steps are pretty similar to POEM procedure. And we have a few clinical cases reported on the literature with the preliminary results. Here you can see the initial steps of procedure, which are the same, the submucosal injection, the opening of mucosa, the entry to the tunnel, and the creation of the tunnel with subsequent myotomy of the muscle fibers. But the application of the third endoscope space was not only limited by the submucosal myotomy. So it led to the development of the new technology, which is called submucosal tunneling endoscopic resection, also known as STAIR procedure, for submucosal non-epithelial tumors. And if you look at this video with the steps of the procedure, you can see that the initial steps are really very similar to point procedure with the submucosal injection, the entry point to the tunnel, and the creation of the tunnel in order to get to access to the submucosal tumor. Here you can see the creation of the tunnel, the cutting of the submucosal fibers until we get to the tumor itself. And when we visualize the capsule of the tumor, we accurately mobilize the tumor from submucosal tunnel, and with complete mobilization of the tumor, here you can see we see the upper pole of the submucosal tumor, and by cutting the submucosal fibers, we mobilize the tumor completely, and then we remove the tumor from the tunnel. And then we close the entry point to the tunnel mucosa with the endoscopic clipping, like the same we do in the point procedure. And this is the new application of the submucosal space. So talking about the future perspectives, you can see on the slide the future technologies which are still under development, like removal of intramural lesions, harvesting the tissue or stem cells, the placement of the stimulating monitoring devices, reshaping anatomy, or biopsy of the nerve and muscles. But all of these technologies could be the innovative treatment of the well-known diseases like the inflammatory bowel disease, diabetes, or the gastric motility disorders, because we here in these technologies, we've got the approach to the target tissues like neural tissue, interstitial tissue, or muscle fibers. And here are some published data on the first clinical cases, like, for example, the biopsy of the submucosal lesion in the submucosal tunnel, or the implantation of the pacemakers to the submucosal space for gastric motility disorders. And in conclusion, I want to say that the first space endoscopic surgery is really evolving technology which include more and more new techniques each year. And the initial results are really promising, but the further experience is needed for analysis. And of course, the training of advanced endoscopic skills is really important for surgeons. And I want to thank for this invitation, and I want to invite all of you to come to Moscow in December for the 6th Moscow International Festival of Endoscopy and Surgery with the 8th European US Congress within the bounds of the festival. It's going to be the first 2 days. Teşekkürler.